been met with mixed reactions. Health Minister Dr Aaron Motsoaledi has acknowledged that the Provincial Health Department is in a crisis, citing the Life Esidimeni Tragedy as one of the issues that exposed inadequacies in the department. Some, however, argue that a plan of this kind is not only needed provincially but nationally as well. Minister Motsoaledi joins us now live from our studios in Parliament to take this discussion further. Minister, good morning to you and thank you so much for coming through.
Good morning to you and good morning to the viewers out there.
Thank you so much indeed. Now, the Gauteng Health Department, Minister, I believe you would agree that it's been plagued with so many challenges for years. Why wait for something as tragic as Life Esidimeni debacle for a step like this to be taken?
I'm not sure why you assume that we waited for a tragedy. We did not wait for a tragedy because nobody plans a tragedy. But as you are aware, the issues that led to Life Esidimeni are purely provincial functions. This is human resources, financial management, procurement, and maintenance of equipment and infrastructure. These four are provincial functions, and you can trace Life Esidimeni over to procurement processes, which is not part of the what the national departments do. But after the Ombuds made the ruling, if you look at the recommendations, he said, I must work with the Premier of Gauteng to reverse what has happened in the tragedy of Life Esidimeni, and also do certain things which led to the alternative dispute resolution mechanism, which is now headed by Judge Moseneke. It was during that process when we discovered this gross management inadequacies. I even told the Premier earlier that time that the whole management of the department might have to be overhauled. And I think that is what we're trying to do now.
Yeah, and during the media briefing earlier this week, Minister, you have acknowledged the fact that the department is indeed in a crisis. But how deep is this crisis? Can a total collapse of services in that province be avoided?
Well, there's no total collapse of services in that province. Actually, what you are not mentioning is that in the same media conference, I alluded to the fact that the Department of Health, the health system in Gauteng, is the biggest, not only in South Africa, but in the whole continent. It still remains the biggest. And during question time, I alluded to the fact that even when the Office of Health Standard Compliance is doing their inspections, most of the health facilities that were rated the highest were in Gauteng in terms of numbers, more than in all the other provinces. So it still remains the biggest, but yes, it is having problems, and that's why we're intervening.
Yeah, and not so long ago, the Treatment Action Campaign in Limpopo took to the streets over poor conditions in the healthcare system in that particular province. And at some point, there were also reports of no HIV testing kits. Would you then not agree that a plan of this nature is needed nationally, not just here in Gauteng?
Well, we look at this situation according to its merit, according to the merits which it have. We actually examine what actually might have caused a particular negative situation before we act. So it can't be all size fits all. At the moment, we have noticed and recognized this management inefficiencies in the Department of Health in Gauteng. That's why we are intervening. If there is any other reason to intervene in Limpopo, we should do so. I'm sure you are aware that we once intervened in 2011 via Section 100A of the Constitution, where we intervened in 5 government departments, including health.
Yeah, and is there perhaps a time frame for the task team here in Gauteng?
Just come again?
Is there a time frame for this task team here in Gauteng?
Yes, we set a 6 months to a year. We expect the preliminary report within 6 months, at which time we'll then decide whether there must be an extension for another 6 months or whether it is enough. but we give them 6 months to a year.
Now, Minister, in the light of the World AIDS Day that will be commemorated tomorrow on the 1st of December, what's the state of affairs in terms of new infections? Because I know that was quite a huge concern for the department.
Well, let me put it globally first. I'm sure you're asking this question with the background that last week, Monday, the Executive Director, UNAIDS, moved from Geneva to come here to South Africa to release a global booklet called The Right to Health, talking about HIV/AIDS status in the whole world. That booklet was released officially in Khayelitsha, where I also attended, which shows that there are 21 million people who are on ARVs globally, and 4.2 million are in South Africa, which makes it the biggest program ever in the whole world. It further states that 16 more people around the world has to be put on ARVs, and 2 million of those in South Africa, and that is the plan we're developing.
All right, Minister, we'll leave it at that. Thank you so much indeed for talking to us. The National Health Minister, Dr. Aaron Motsoaledi, talking to us about the situation of health status here in Gauteng and, of course, looking at the overall picture of the national picture. All right.